Good afternoon and welcome to the Facility Show Connect webinar. I'm Sarah Bean, editor of FMJ, and I'm delighted to moderate this panel session on how data-driven decision-making can help you improve the performance of buildings and the facilities they provide. This is an interactive session, so please do post any questions you'd like to ask the panelists using the Q&A box at the top right of the screen. Questions won't be made public, but will be fed through to me, so I'll be sure to pick them up and put them to the panel either during the discussion or towards the end of our hour. If you experience any technical problems, we've got a chat box on the site for one of the technical team to help you. And if you do miss any of the session or would like to re-watch it, it will be available to download until the end of July. As COVID has shown us, data is key in helping us make informed decisions, and the FM sector has become more reliant on data and technology than ever, with decisions now expected to be based on hard data rather than gut feel or experience. Our panel offers some unique insights into how best data can be mined for maximum effect. You can find out more about their roles in the biogs we've posted on the site. But I'd like to get straight to it and let them introduce themselves and outline their particular areas of interest. I'll start, if I can, with you, Edward.
Hello, yes, my name's Edward Payne. I'm Chief Engineer for Kettering General Hospital. I've been working in healthcare for over 20 years now, most of the time in the NHS, but also working for some private health companies and charitable healthcare. So it's given me quite a broad knowledge around the healthcare sector and how different people operate. I principally work in the hard FM side on the engineering services and building, but also do have an input into the soft services elements around the catering, the housekeeping, portering, linen, the utility management and things like that. Obviously, NHS is highly regulated and we do have to provide a lot of information back to the Department of Health. So FM system is very key for us to be able to have accurate data that we can use to report. So it's one of the things I've been interested in, and in various sectors, I've implemented FM systems in all of them, not always the same. And so I've had quite a big background, quite a big broad knowledge of implementing systems and the data that they can provide.
Excellent. If we move to you, Mark.
Thanks, Sarah. Thank you, Ed. I'm Mark Griffiths. I'm the founder of WA Consulting. We're a very modest consulting organisation specialising in facilities management and the workplace. Prior to forming WMA 2 years ago, I was Operations Director for Bouygues Energies and Services FM division. And prior to that, I was Senior Manager for Skanska in their facilities management sector. And in the last century, even worked for Interserve for a short period of time when they first formed in the marketplace. Our focus and my focus has always been the operational benefit and the value add of FM, and what can that bring to organisations, and more recently how that manifests itself in the workplace. A lot of experience in the defence, healthcare and education sectors, as well as the wider commercial sector, both from a project management perspective, but primarily FM, and how that soft landings approach can help with the handover and the delivery and operational phase of a project work to the benefit of an organisation. And a lot of that, as I've seen the good, bad and the indifferent of how data can be handled and handled well. And I'm a great believer that if you can get that right, it can really bring benefits to organisations.
Excellent. And Hazel?
Yes, thanks, Sarah. My name's Hazel Bedson. I'm Director at ServiceWorks Global. For those of you that don't know, ServiceWorks Global is a provider of FM software. So that includes CAFM, computer-aided facilities management. We also provide solutions for space and workplace management, and also for BIM, for building information modelling, and how that can be used within the operational FM phase. On a personal level, I've spent most of my working career working within software companies. So I started off in property and real estate management. More recently moved into facilities management. Originally from a marketing background, I now work strategically across the business. We work with a really diverse sector of customers, so I'm used to understanding the customers, their different requirements for FM software. I also work internally to help implement systems internally, so I've got first-hand experience of the challenges of implementing a system and the best way to get the most out of them.
Great. That will be useful to talk about later. Now, last end of last year, we published a survey that we did in conjunction with Service Works groups in the UK and Australia on the use of software and specifically CAFM. And there was an awful lot of data, which was, again, very useful. The survey found that 2/3 of the respondents were already integrating their CAFM with other software, such as the BMS or health and safety. Hazel, it'd be really useful to get an idea how that works in the practical sense, how this was typically integrated here, and so your insights into why particular areas are most popular.
Sure. Yeah, I mean, as the survey showed, integration is fairly commonplace and it can be incredibly valuable for the FM team. One of the most common integrations we see at ServiceWorks is integration from a financial perspective. So we've got a customer that runs a major sporting venue and they integrate our CAFM software, QFM, with their other purchase order and ERP finance system to give them a complete record of all the costs around each sporting event. It's a two-way live integration, which means data is only input once. Obviously, this reduces duplication, error, saves them time, and most importantly, gives them as a business an accurate cost picture for each sport event that they run. We also work with quite a number of healthcare clients, Edward at Kettering being one of them. And quite a number of those have a number of different integrations that are unique to the healthcare sector. An example of a healthcare specific one might be integration with patient administration systems. So these are the systems that support the movement of patients throughout the hospital or the healthcare facility, that control the admissions, the discharges, the movement from one space to another. If you integrate that with your FM system, you can link up the movement of patients with the requirements for the FM team to maybe clean a room or service a piece of equipment. Another common integration we have is with BMS, building management systems. If you integrate that with your FM system, the BMS can raise an alert for the FM team. For example, if a piece of equipment fails, if a component is a specific asset reaches the end of its operational life, the team's automatically alerted, the job's created, the team can be on site, that job can be rectified as quickly as possible. So minimum impact for the end user, but also most importantly, efficiency and minimum cost overhead for the FM team. A couple of other integrations that we commonly undertake are with health and safety systems, security systems, and more recently with BIM, building information modeling models. I think it's probably fair to say that BIM has been more widely adopted in the construction phase up until recently, but it's definitely making inroads into operational FM, and it can offer huge amounts of benefit. If you can take the data from that BIM model and bring it into your FM system, it means the FM team can see the asset, its components, its maintenance history, its energy consumption in its exact location as it currently stands right now. Obviously, the cost and the operational savings can be phenomenal. And that's something we are definitely starting to see an interest in and something I think will continue to grow. So in summary, Sarah, that's how I see integration.
Excellent. We'll go back to BIM in a bit. I'd like to talk to Edward now about the particular digital requirements for his sector, because obviously what we've been through in the last 18 months has shown how important it is for data, and especially in a healthcare setting. And obviously Hazel mentioned just some of the things that can be achieved using the CAFM systems and working with the other systems. What have been the biggest areas you've been looking at, not just in COVID, but prior to COVID and hopefully post-COVID as well?
Yeah, I think space utilization has been a key one for us, actually. It's knowing what spaces you've got and what they're actually used for, the occupancy of them, and what services they have in them. As everybody was aware of during the COVID times, one of the key things was around oxygen. So having the data available to say where we had the best oxygen supplies in the hospital, made some decisions that were quite harsh, actually, where we had to move wards around and put people, the high acuity patients, into areas where we had the better oxygen supplies. And it's because we fortunately had recently undergone some survey work, and we had very good data to say what we had around that. And it was also around the ventilation, because just having the good oxygen supply are the areas ventilated? So it's when we have a room, what is in the room? Is it heated? Is it ventilated? Does it have a negative, positive pressure? So by mapping out all our available space requirements, we could say, actually, this is the ideal space that you need to put this type of patient. And during the really tough times, there were some sort of quite unpopular decisions, but you got to move to where you could actually best support the patients. So I think because of that, having the good data and the space information, we probably managed to save more people. So I think that has progressed post-COVID. We're looking at, again, all our spaces, and not just clinical spaces, it's the non-clinical spaces, the offices, where we would have said, okay, this office will put 4 people in here now, but we look at it and think, well, actually, for health, safety, and welfare in the workplace, we should really sort of limit the number of people there. And lots more people are working from home, so we're looking at now creating more digital offices. So we've learned quite a lot, and actually learning about what space you've got has been really good. And interestingly, on the BIM side, we're just getting all our drawings for the entire hospital remodeled and just revised so they are all compliant with BIM. So that is something that we'll be looking to going forward. So we have a complete model of all the spaces available.
Brilliant. I mean, you are obviously very confident with using these systems and understand them. I'd like to sort of drill back a bit and talk to Mark and Hazel about whenever FMs are starting to look at integrating their systems, or some are even coming to CAFM fairly new, let alone BIM, what measures would you advise they take to sort of identify what they're going to need at the procurement side? I mean, Mark, what kind of advice do you give clients?
Funnily enough, it's come up in a conversation this morning with somebody. A large university is looking to consolidate their CAFM system and go down the route that Edward was describing with integration there between BIM and CAFM and everything else. And I think you need to take it back to basics. Whatever type of project you're doing, I think you need to be very, very clear about what the scope is, what you want to achieve from it, and not probably the most appropriate phrase is one of my favourite phrases is that, if you want bells and whistles, that's fine, but make sure it's going to work. You don't want fireworks at the end of it because you don't know what's going on. You need to control it and understand what you're trying to deliver. There's no reason why you can't augment it over time and improve it. But I'm a great believer in the fact that if you, I'm sure Hazel will follow a similar approach. When they're going to a client, they're going to be saying, this is your scope, these are the deliverables. You may have some latitude for what you can do in the future, but I think you need to keep it very, very simple. Lots of people will use data in lots of different ways, but I think, as we were all discussing beforehand, I think the key thing is using the data in an appropriate way. How big, smaller, and different that data is. Different people will have a different thirst for that data, but you have to be careful you don't become overwhelmed with it. I think that's the key. You need to understand what it's doing for you, and I think that's that might sound a bit simplistic, but people lose sight of that. They get excited by the fact that they're doing something new and appealing and sexy or whatever, however you want to describe it. But it's still got to deliver. All organisations, whether they are a government organisation like Edwards or whether it's a private sector organisation, they will have they will still have a budget and they will have a constraint. Some might contribute to generating profit, others may contribute to making efficiency savings for the benefit of patients or students or whatever sector they're in. And I think that's the key. I think you need to be very clear what you're going to do, have that buy-in from the top as well. Don't go off on your own path. I've been doing lots with the IWFM for a while now, and one of the big challenges for the industry as a whole is having the voice of FM and workplace practitioners at the top table. And finding a way to do that. If you're fortunate enough to be at that top table, that's great, but you need to articulate your position well. And that's an experience I've been fortunate to have, but only on a service provider side of things. But equally, having that buy-in at senior decision-making board level to drive that scheme forward, because if you have that, it's so much easier because it's working strategically. If you want to be considered a serious player, you need to be strategic in your decision making.
That's a very good point. Hazel, what's your take on this? Because you must be dealing with quite a variety of stakeholders during that process.
Yeah, absolutely. I mean, from the perspective of the software vendor, I'd say, as you say, Sarah, it's really important to get input from the right people, especially if it's a new implementation, you're replacing a system or putting a CAFM system in for the first time. And that's not just the FM team. You know, you might need to talk to operations, to the IT team, finance, and as Mark alluded to, almost certainly senior management if it's a big investment. And another point on when you're defining the requirements, again, linking back to what Mark said, it's really important, I think, to define what's critical, what's a must-have, and what's a nice-to-have. Quite often we come across, particularly in a formal procurement, maybe where there's a tender or an ITT, a huge, vast list of requirements that would be probably impossible for any one vendor to meet all those needs. So identifying the scope, identifying what's important and what you want to get out of the system will really help both you and the vendor that you're working with deliver what you need.
That's a very good point.
And I'd say also, Mark mentioned senior management. It's so important to get their buy-in. You know, we've seen things fall because there's been a perfect solution identified, but senior management maybe don't understand the benefits, maybe don't understand operationally, or more importantly, the cost benefits, and it doesn't get signed off. So try and identify what the benefits are, both operationally and financially. If you can, build a business case, maybe try and put a return on investment sort of projection. You're making this investment of X £1,000 now, but what will a savings be in 3 years? What will a savings be in 5 years? And I know that we certainly work with some of our customers to help them build that. If the FM team isn't experienced in doing that, then a good vendor will work with you to help build that business case and put those figures and, you know, identify the benefits that you will see as an FM team further down the line. That's
great advice. If anyone's got any specific questions on that area, do let us know, because Hazel's here. She's giving you some free consultancy. Now, I mean, so you're getting your system set up, and then you're integrating your software requirements. So, Mark, back to you on this one, because you're involved in quite a number of projects. How do you ensure involvement from the right parties at the right stages, especially in those really big, large-scale projects?
I think that is a challenge, and also I think one of the other things you need to be mindful of is preconceptions. You know, people will go in preordained ideas of a way forward. So I know we're going to touch on it later, and I won't dwell on it too much at the moment. But I'm working with one client at the moment that's looking to do a large-scale investment into a new facility, and that is going to cost tens of millions of pounds, and we're initially helping them with their facility strategy and how that will work, and effectively developing a soft landing framework for the project to transition across to the FM team and get the operational delivery correct. The quantity surveyors involved with the project, so I started speaking to them about BIM. What level of BIM are they going to deliver? What did it look like? Oh no, we're only delivering it on the construction phase. We're only going to deliver it to level 2, and we're not doing any more because it costs too much. But going back to Hazel's point just now, when you direct the conversation, so fortunately we had the ear of somebody in the finance team, you know, at the time during that conversation, and so, but it's a matter of, I think it's sometimes FMs are victims of their own destiny to a certain extent. You've got to tune yourself into the language of the people that are making the decisions sometimes. And so finance directors, we know what they equate with. So all of a sudden, if you're talking about, well, over the 5 years of this period, I can save you money, and your spending on that estate from an OPEX perspective is lower. All of a sudden, you're in a different conversation, and people will see it as an investment because they've got some scale of an ROI. And I think it's understanding what those measures are. I used to work with a chap who was a lot cleverer than I, a client, some time ago, and he used to have a little phrase that anything you were presenting data-wise just needed to be follow an acronym called ART. And if it was accurate, it was relevant, and it was timely, you would get that. You need to get in front of those stakeholders, as Hazel said. That's the key thing. You get those stakeholders have got to be right. And my advice to anybody would be, don't be afraid to politely challenge if those stakeholders are the right people, or have the ability, the empowerment to influence the people that will ultimately sign it off, because depending on the scale will dictate where it goes. But I think that's the key takeaway. You've really got to get that that buy-in there straight away. And if you get that, the projects I've worked on that have had that, and everybody understands who's who in the zoo, another phrase I've picked up. But you understand how it works, what everyone's role is. It can be can appear to be quite bureaucratic, but you have a process and you can follow it, and you know where you're going. It makes life so much easier. For the end result, there are always going to be frustrations in the part in the middle, but it does come together and it does work well.
Some good advice there. Also, obviously, for you, Edward, you're going to be constrained to a certain extent in healthcare by budget. So when you're choosing software, what would you be looking at as it's a must-have rather than it would be nice to add that on? Have you had situations where you've gone, we just can't? I mean, as Hazel was saying, sometimes people want bells and whistles and they don't know why they want it. How do you decide what is essential and what is, if we had the budget, we'd do it, but we can live without it?
Like bells and whistles. Well, I think for us, we had a couple of systems that did various things. So we had a basic system that did our reactive maintenance help desk and also did PPMs, but it didn't do any of the space management. And we've also got systems that did some of the cleaning audits that was based on space, but that's completely separate. And then we've got other systems that do a little bit of stock control on linen and medical gases and things, gas cylinders and things like that. So the key for us was actually, let's get it all together. Because if we change one thing, it changes it for everybody, for all systems. And also the porters, initially, currently still are, it's somebody phones them, a porter and supervisor, and then they try and phone and contact the porter, but we'll be able to integrate that in as well. So we did want bells and whistles. We haven't got it all yet, but we're on that journey to get there. So the key thing for us was, I guess, is the space, knowing what space we've got, knowing who's in the space, what it's used for, and then having all the information around all the assets in the space and the PPMs, planned maintenance we can carry out, and all the maintenance requests. And then also we're looking to expand on to some room booking systems, the portering system, so we can actually control, we know where everybody is around the site. So it wasn't a case of very basic requirements. It was, we want everything we can possibly get. And all these 3 or 4 systems we've got, integrate them, all these little odd spreadsheets that people keep separate with bits and pieces on, let's have that all in there together. And as I say, it was a journey, and we did engage with everybody, all our stakeholders. So we got all the catering manager, the portering manager, the cleaning housekeeping manager, the maintenance manager, and then the project team, and get them all together. So hopefully we've got them all on board, and we will be moving forward and trying to get to develop the system further.
That's interesting, Hazel. From the sort of your perspective, that's almost like a change management process. I could just imagine you sit in a room with a client and these people putting their hands up and going, "Oh, actually, I could really do with being able to measure this." Is that kind of how it goes sometimes with clients?
It can be, and often we're dealing with, we might have a project team and there might be different stakeholders with very different requirements. And the people will change during the cycle. So we're not necessarily talking to the same people at the outset as when we're implementing the system. And I think it's important to maintain some continuity there. So maybe have somebody who's there at the outset and then helps drive it through, somebody who owns it, maybe 1 or 2 sort of champions, and that's incredibly useful because it maintains continuity with the vendor and also with the people who'll be using the system further down the line.
Good point. Mark, back to you, because you're dealing with private sector clients as well, who might have a little bit more money in the pot. What do you find in terms of that, if you're sort of talking to them about what is important and what isn't? Do you start with an end game? What is it you want to benefit and then work your way backwards, or is that too basic a way of looking at it?
I don't think it's too basic a way of looking at it, but I think it's understanding the individual organisation, irrespective of what sector they're in. We've just recently helped a client, a large stockbroking organisation, with their move to their new European headquarters in London. Not the best time to do it through a pandemic would be my advice, but hey, these things happen. But it's been interesting, but they're very much focused on risk. Some of that is regulatory risk and the like, and within their organisation they have competing brands and they have a lot of direction from the governance in the City of London about what they can do and what they can't do. And so that they're not risk averse, they're very risk aware, but they have a lot of specific requirements that work in that. So the integration of the data for their security management system and how they access the building and who can come in and when they and where they can come into is very, very specific. Whereas other organisations, they're very much around a more softer approach to their facility and the workplace, and how that's going to make people feel a lot more comfortable, and especially at the moment with some of the advice we're giving people in the post-pandemic world, having more space around them. They still want to occupy their offices, be there all the time. That if they've got hubs for teams that have got to work together, they're utilising that space in a different way now. And so I think it's the age-old adage of listening to your clients, whether they're internal clients, the people you're serving, or whether you're somebody in a position like me and Hazel, where we're offering our services in different respects to those clients, is understanding what they want and maintaining that flexibility and approach. I think that's the key thing now. I think there's agility is something that, and a certain amount of dexterity in what your proposal looks like is key. And there's a lot of expectation now in the marketplace with data. People get excited about data, and rightly so. It's a lot of potential, but it's not like something on social media. It's a different type of tool. You're not, you might be liking something because it's customer feedback or something, but the way you utilize and access that data is actually a lot more sophisticated than it needs to be. And so maintaining that flexibility for that to balance it for the requirements of that business is key. And I think the more tactical and strategic thinking that organisation, the more successful it will be, at least in my experience. That's
a good point. I mean, one thing that is obviously what this webinar is about measuring data. And the data analytics side, I've seen in various presentations, people have said that, it's an area that FM needs to get a bit more sophisticated about. I mean, I would go to you, Hazel, first on this. What advice would you give on managing data to make sure it is actually yielding the right information? How do you actually guide people in that respect?
Yeah, I mean, this session's all about using data for decision making, but a system or systems are only as good as the data that's going into them. And if people aren't using those systems properly, if they're putting the wrong information in or omitting information, then the outputs aren't going to be as valuable as they could be. It's the old concept of rubbish in, rubbish out. Yeah. So, user adoption is really important, both at the outset and ongoing and moving forwards. And I alluded to it briefly earlier, but something like a super user, a system champion or champions, depending on the size of your organization, somebody who effectively is the internal owner of that system, can be really helpful. An FM team typically will have a wide variance in terms of ages and skill sets. Some people might be incredibly comfortable using a mobile app, some people less so. And if you're rolling out an application that requires input on a smartphone or a tablet, then some people might need more help than others, and having somebody in-house that can help guide those users and field questions can be dramatically helpful. It can really help the quality of data that's going in. It can identify training needs, go back to the vendor if needed, or manage those in-house. And it also helps moving forward. So if you've got somebody who owns it, who their system is their baby, they know how it works, they know how the users use it. You bring on new staff, you bring on a new team, they can get up and running quickly and maximize the system that you're using.
That's great advice. Now, obviously, we're still talking the pandemic, I'm afraid, and obviously it's been used a lot. Data's been used so much over the last 15, 18 months to make places feel safer. There's a far greater use of sensors to measuring throughput, to measuring cleanliness, whether stations have been kept clean, etc. I mean, I'd go to you first here with this, Edward, since you're working in healthcare, but what do you think will happen in terms of the digital technology to monitor the safety of a building? And also, how will that work going forward? Because there has also been some arguments that, post-pandemic, people are going to just stop going into work if they've got really bad colds or viruses, or all the other things we used to put up with and think almost it was part of working life. And in healthcare, the last thing you want are sick people.
Yes. True, and true it is. Yeah, it's been very interesting actually. The pandemic has actually brought some bonuses in a way. Is that people have digitalized a lot quicker than they would have done otherwise, which is why we're in what we're doing now on a Zoom conference, whereas this would have been an annual conference somewhere. So people have become very aware that digital is the way to go. A lot of people that could work from home immediately went to work from home. There are some departments can do that remotely, like the finance department. They don't necessarily need to be on site. So if you can do that, then that's great. So they will continue to do so as much as possible. People will continue to work at home. That is a benefit for us going forward. Obviously, a lot of the people can't work from home. So keeping them safe is the important thing, which is why we need to understand the spaces around us.
Yeah, I mean, you must, Mark, have been involved in this quite a bit as well. I mean, I don't want to jump too much ahead, but people are planning for returning to the workplace, hopefully over the summer, at least by the autumn. But then they've also got their longer term kind of planning to do as well. They're going to need an awful lot of data, and they're going to need to be very agile to manage all of this.
Yeah, very much so. And I think that's the, as Edward alluded to just now, I think that's the one thing from the last 18 months or so that we have adopted that data a lot more readily now. I think I read something the other day that a paper, I think it was McKinsey or somebody, said that we've moved on in 8 years worth of shift in terms of the utilisation of data and the remote working and everything else there. But I think with that return to the workplace, and there is an appetite for that return for lots of different reasons. I think some of the more well, there's some high-profile organisations at the moment that are making a lot of noise about being in 5 days a week. Let's leave it at that, and others that are perhaps having a more flexible approach to it. But I think, despite the fact I'm talking about data, I think everything that we do in the workplace and FM, it's still very human-centric, and there will be that need for people to get together. I think that's a natural thing for human beings anyway, without which we get too social about it and everything else. But people naturally want to work together when there's a team effort to be arrived at, and I think that there will need to be a lot of agility, and I think some of that agility will naturally hang around as a result of what's happened in the last 18 months. So we've got a particular client that's trying not to impact the workplace that much because of the nature of their business. People need to work together quite a lot in quite big groups, so they have thermal imaging cameras that take people's temperature as they come in, takes their photo, alerts a help desk if their temperature, in light of the pandemic, obviously when everything was really bad with lockdowns, and they're still using that system now, and they're integrating that with indoor air quality monitoring now, and that's something that done a separate piece of work with it, and there are many CAFM and BMS and EMS provider that are now trying to integrate these items so that you're optimizing the amount of fresh air that's in a building. More and more people, in my opinion, are going to be asking for that. As employees are going to be asking employers, how much fresh air are you putting into this sealed box that you want me to come to 3 days a week? Which, being crude, is what an office block is. There are a few urban myths to dispel in that as well, because the air is a lot cleaner than the air you walk in when you're walking down from the bus stop or the tube station or whatever your mode of transport of choice is. But I'm a great believer that whilst there's a lot of risk in terms of management, it's also a fantastic opportunity for the industry to really show the added value it brings. And I think the more agility and the more informed, accurate, timely responses you can bring, the more credibility and more resonance that the FM and workplace function is going to have.
I mean, Hazel, from your perspective, you must have been developing quite a lot of these tools over the last 18 months, and all of them are probably going to be used to be fed in to measure, the safety and productivity to a large extent of the workplace going forward, both in the short term and hopefully once we finally can wave COVID in some ways goodbye, how people are going to run the offices in the future.
Yeah, absolutely. I mean, we have a product which is about designed to help people return into the office safely, obviously in the times right now, but that links into a sort of a wider piece around space management. Edward alluded to it earlier, the importance of the utilisation of space, both operationally from a COVID point of view, but also from a cost point of view, and then how that feeds into FM in terms of your day-to-day maintenance. And bringing that all together in one system can offer huge benefits. So both long, mid and short term, I think.
So, I mean, we did touch earlier a little bit on BIM, and I think it's important we don't leave it out, although it's probably a webinar all of its own, but it'd be good to talk a little bit about it. There's been some research done, obviously, on uptake of BIM and FM. There was a great point made earlier about, a construction project where they wanted to stop at the construction bit rather than the FM bit, which is when you're going to actually use it to look at your asset management. So, I mean, if FMs are looking at their sort of longer term data driven, and if a lot of FMs are going to be in a situation where workplaces are being radically refitted, is there a way of then introducing BIM into the mix, and from either retrofitting or a new build? I mean, Edward, have you guys been looking at it from the healthcare situation?
Yes, I mean, fortunately, we've recently been awarded some government funding for new builds, so we could have as much as £400 million to redevelop 50% of the site and to completely rebuild. So what we're trying to do with the existing is make sure all our drawings are aligned with BIM, so we can BIM model and we can develop those, because they're going to have to integrate with the new buildings that will all be BIM as well. It's fairly early days, and I'm not a BIM expert. Like you say, that could be a whole new conference on its own. But yes, we're trying to align what's new with what's existing. What we keep as existing will be aligned on the BIM side with the new buildings coming on stream.
Great. Mark, what about your view on that?
Yeah, we're working with NHS clients who have a need with BIM, and private sector clients as well at the moment. And I think that which can sound too pompous, I think the call to arms that needs to be out there for FM as a whole is they need to adopt it more. I think some of the tools are there, they're not perfect. And I think I had a quick read of the ServiceWorks survey that was a precursor to today's session. And I think there's there's not many people committing to BIM at the moment. They're considering it. Hazel, if my memory serves me correct, and only about 17% were fully on board with it. And I think the government have mandated it. So for government projects, it's there. But if you look at all of the pressure around carbon reduction, and what you're doing with construction and what you're doing in operational phases as well, of any type of estate and facilities, wherever they are, it's naturally going to come. And I think there are learning lessons from different sectors of the industry. So some of the commercial landlords, British Land, for argument's sake, are doing a very good job in terms of what they do about reducing the carbon output of their new development. So they've done a huge amount of work at Broadgate. I've seen a little bit of what that is, and there's a lot of PR that's out there about the benefits they've brought to their schemes. And in the construction industry, it's not unusual for the mechanical services contractors to come to a site and do a point cloud survey and digitally scan the space and understand where they are, draw that line similar to the one that Edward was alluding to just now. And they've taken a digital scan of that area, understand where they are and what they can do to move on to deliver their works. Experienced FMs who have a good understanding of data, I don't think it's data analysts, are what's needed now. And they, it all goes back to all this good stuff, such as soft landings and being involved as early as you can in the process is only going to benefit everybody. So you're not, when you get a call from Room X, you know that Room X has got a life expectancy of 20 years and it's had 25 widgets replaced in the last 7, and you have a good potted history to it, and everything works. So, there's no reason why you can't turn up with an iPad and hold it up on the wall and it shows you what the services are above the ceiling. So you haven't got John Smith climbing up some step ladders, sucking on his teeth, going, "Oh, that's going to cost you, mate." But it's historically what's happened, and so FMs need to step up and be more top table in their behaviour, I think, and that will help hugely in everything that you do and deliver a more quality driven service.
Well, Hazel, I mean, do you find that when you're dealing now with clients that they want to embrace the idea of BIM, but they're not quite sure where to start?
Absolutely. I think this is a bit of a generalization, but I think there's maybe a lack of understanding, as Mark says, about BIM and what information is required. Obviously, the amount of detail in a BIM model from the architectural and the construction phase, the FMs don't need all that. But parts of it can be incredibly useful, as Mark said, to the engineer that's on site to see exactly what's above that ceiling or behind that unit. And I think it's just a case of talking to an expert, whether that's a vendor or a consultant, who can give you the advice. People are sometimes maybe a bit too scared to admit they don't know what questions to ask. We are working with a number of companies here in the UK, and also we've got an operation in Sweden, and they're maybe a bit further ahead in terms of digitizing buildings, as Mark mentioned, using the point clouds to digitize buildings. But we're definitely seeing an interest in it now. And what I would maybe say is, if you've got a large estate or a number of facilities that you do want to leverage the BIM model and use it in FM, don't tackle it all at once. Maybe do a pilot, maybe take one site, get that working for you, understand how you can use that data in FM, and then roll it out at a larger scale.
That's good advice. I've got some questions that have come in, and the first one is actually on digital twin technology, which is obviously allied in some way, I think, to BIM. Is this something that can be used more when it comes to maintenance? Mark, do you want to take that one?
Yes, I think it can, and I think it also helps you significantly with risk management as well. And yes, it can be a good aid. So it can be effectively your digital O&M reference point, or something akin to that, or a digital accompaniment to the O&M, and give you an insight. And also, as you develop the asset over time, so that will help hugely. It's something that gets often overlooked when people talk about the value of a building. So there are some well-established principles of the RIBA about what you do to deliver a project, and you start at stage 1 and you get to stage 7, and you're effectively 3/4 along that track, handing over the project to operational FM, and then it goes off into the ether, and the construction people will hand over their project, pat themselves on the back, thank you very much. If you look at the operational costs of a building, say over a typical 35-40 year lifespan, they dwarf the capital cost of building it. And that's the language that FMs aren't using enough in terms of what they're doing. If you talk about that being an asset on somebody's books and having a value over a given period of time, the whole dynamic in the conversation you're having changes, and digital twins will only aid that, because you can start to forward plan what you're doing. And I think, picking up on Hazel's point earlier, starting early on that, digital twins, they're a great thing, but you need to be very prepared for that. So starting off in a pilot project or somewhere small, and we mentioned earlier when we were prepping for this call, I was talking to somebody else earlier, and he said the data doesn't necessarily have to be smart, it can be daft, but you need to start somewhere. And if you start with a bite-sized chunk of that data, test it, prove it, you can get to the more sophisticated things. But it would be remiss of me to try and indicate that the built environment sector, especially in the FM area, is as sophisticated as it thinks it is. It's got some way to go. The potential is huge. It's massive. And I think if anyone wants to see the value of a digital twin, on iPlayer, there was a series of, I think they're still on there now, a series of programs about the fire at Notre Dame Cathedral. And the French government had commissioned a point cloud survey of some kind of Notre Dame Cathedral. And if you watch that, you see, and they've been able to reconstruct it after that terrible fire of a couple of years ago, and get all the accuracy right about what they need to do about the type of wood that's in the rafters, how it was configured, what it was all made of. And it's a fascinating, I'm a bit of a geek on those kind of things, so excuse me for going on about it, but it's ever so interesting in terms of where you go and what you do with it. And that really shows the benefit of something like that. And that's something that was built however many years ago, 600 years ago. That's able to be done now. So if you've got something new that you can do that with, or something, even if you're fortunate enough to work in an historical building that hasn't got that, then if you are in a position to find a way to invest in that technology, that is only going to help you in the future. And also give you much more data to manage, and accurate data to manage in terms of where you go with it.
Is this something that you guys are looking at in healthcare, Edward?
I'd have to say no.
Good quick answer. At the other end of the scale, here's a good question, which shows you the sort of breadth of experience. Is there a company size or site at which point CAFM becomes almost a necessity? Hazel, can you believe you've been asked this question?
Not really. I mean, I think it is so unique to requirements, and most CAFM systems will be as small or as large as you want them to be. I mean, the benefit of a CAFM system is it's centralized, it's auditable. You know, spreadsheets are great if you've got a very small amount of data, but obviously there's a risk of someone overwriting it, corruption. So I would say, if in doubt, reach out to some vendors, talk to them about your organization, talk to them about budget as well. You must have an idea of what you're looking to achieve operationally and what you're looking to spend. But I would say pretty much no, Sarah. There's a CAFM system for everybody.
Yes. Well, sort of allied to this, are there particular vertical market sectors which are embracing CAFM more than others? Edward said, example of healthcare, obviously. I mean, if you come across any sort of healthcare environments where they're not using as much data as they possibly can at the moment.
Is that directed to me? Sorry, Sarah, or to
no,
Edward?
Sorry, to Edward.
Yeah. So, right, okay. Yeah. Well, I think the requirement for the NHS as a whole is we all have to report annually to NHS England and NHS information. There are various things. There is estates return information we have to do, and premises assurance information we have to report. So we all nationally, every hospital will have to report, say what area they've got, how much clinical space they've got, how much non-clinical space, what the utility costs are, and various things like that. How much we spent on capital improvement, what is the backlog, all these sort of things. And to have that information, get that data on a spreadsheet is nigh on impossible. So that I think it's essential that you have a CAFM system, and if it is quite finance driven as well, if you can have some link with finance, because we have to break down how much have we spent on linen, how much have we spent on medical devices, things like that. What area of floor space does the medical records department occupy? And having that space information is we can click a little button on the space module, and it will just run us a report and say, that's the clinical space, that's non-clinical, this is retail, these are the offices, this is changing spaces, and that's great. And that makes it very easy for us to report. Having worked in smaller NHS organisations that didn't have adequate CAFM systems, it was always an annual hair-pulling exercise to try and work out the information. And all that information gets published, and then you can benchmark against all the other hospitals, and you can tell the ones that haven't got decent systems, because some of their reporting is probably far from ideal.
Oh dear. Well, back to actually the idea of the consistency side in terms of data. Given everyone's got a different property footprint, how do you ensure consistency in what data is collected and how it is interpreted? That's a very good question. I mean, Hazel, I'll throw that one to you. I'm sure you.
I mean, this is something we'd normally identify when we're talking through the requirements. We configure our system to meet the customer's requirements, and we deal with, you know, from very small estates to very large ones across all sectors. We support PFI, PPP contracts as well, obviously, where there's very strict requirements for capturing data and response times. So I think really it's just a case of making sure that you select a system and a vendor that has experience in the sector that you work within, and is open to having discussions with you about meeting your needs, and whether that's in terms of data input or working with you on sort of personalized reporting outputs.
That's a good point, actually, about the sector that you work in. I mean, Mark, you're sort of working across a lot of sectors. Do you find that people are measuring data in different ways depending on their sector, or is it actually down to company and almost the stakeholders that you're dealing with?
I find the variances sometimes are with the service providers, which is frustrating. And I think what there isn't, there's a baseline of standards. I think that some and not enough people kind of adopt those as the minimum level, and then they become sector specific. And I think where you're in a regulated environment such as Edward, I think there are lots and lots of, I know from personal experience, and a lot of work as a service provider to healthcare clients, lots of requirements there and lots of data that needs to be reported to the centre for lots of different reasons. But there's a suite of documentation out there on the CAFM piece that's fairly simplistic in terms of what you want to do with on the hard FM front at least. So you have the RICS new rules of measurement number 3, how that aligns with service life planning for life cycle replacement, and how that aligns with something such as SFG 20. And BISA have done a fantastic piece of work with SFG 20 in the last couple of years. I was on a webinar with them a while ago where they've got sector-specific variants to that now as well. So there is that minimum level, and I think that's the entry point that people need to, and that's something that's fairly well available to people. But I think having that, at least in the UK, and I think internationally it's fairly well recognised as well, having that suite of standards, at least on the engineering front, and there's recognised standards on the cleaning side of things and those kind of areas and what you're doing, and having that minimum standard there and then developing it sector specific is where you go. I think that the clients such as the NHS are very well informed about what they need to do to comply. I think there's a lot of areas there. Other clients not so much so, but I think if you go in, at least from a consulting perspective, advising your clients, that's the way to go. I think that has a lot more credibility than something that maybe develops on the hoof, for want of a better phrase. But I think that will always be my advice to clients: go in with a understanding your minimum entry level, what you want to do to satisfy yourself that you're compliant, you're delivering reasonable level of service, and you understand what may be coming down the track financially. Going back to the point Hazel made some time ago, I think if you're talking in those terms of kind of measuring money, risk, and time in a little triangle, and if they're equally split or they vary, you know what the effect is elsewhere, then that is going to, I think, help people a huge amount, huge ways.
I mean, allied to that is someone else has asked, how do you measure data quality in your system? I suppose that takes us back again, Hazel, to what you put in that you want to find out.
Yes, I mean, that you really need to define what you want to go in. Clearly, there's things you can have sort of mandatory fields, but that's not often enough. It's really about having somebody to guide and mentor the users, and it's not just, okay, the system's live, here we go, happy days. You need to keep managing that, and vendors can work with you on that. They can do it might be called a health check or something similar to work with you. They might spend a day or half a day with you and look at the outputs you're getting out of the system and say, look, this could be better if you could guide your users to do X, Y, Z. If in doubt, don't be afraid to reach out to the vendor and say, look, we're not getting what we expected from the system here. They'll work with you, and whether that's to help guide the users, help configure the system slightly differently, or maybe it's just a case of configuring a new report. Don't be afraid to ask questions.
Is that your experience, Edward, in terms of finding out what you need to know before you start running the system, as it were?
I think it's regular reporting. So I think we do reports, and if they're even internally and the national ones as well, that we always look at the top 10% and the bottom 10%, the outliers, and drill down into those a little more as to why they're so different from everything else. Was it a mistake? Is it poor quality data? Or is there a real issue? So I think it's the reporting side that is really key for us on a regular basis. It gives you something to focus on.
And one final question, because we've only got a few minutes left. Our survey found that, I'm taking the FMJ SWG survey found that centres and smart buildings were the second most important trends within FM. And they've only obviously grown in usage over the pandemic. So I'd just like to sort of kind of go around the panel and see, have you seen an upsurge in the use of this? And that would include things like robotics, AI, that side as well. Let's start with you, Mark.
I think robotics and AI is slowly coming down the track. Not as fast as the adoption of sensors in my experience. I think there's some clever people using some sensor and the data analytics out of that very well at the moment. I was the lead judge for Technology Award last year for IWFM, and there's some really interesting things that are going on in the market now, and some of it's very simplistic, but it's how they're distilling that data and really making it drive for better outcomes for the service. And I think that use of the IoT sensors and the like now, it's years ago, I think it was when I had a proper job when I was an engineer, you used to talk about open protocol BMSs and talking to each other and everything else. And I was having those conversations 15, 18 years ago with people. And now that's a lot easier to do and take on board and a lot cheaper to implement. It was very cost prohibitive in the past. But now, we all know how quickly apps can be brought online on mobile devices and the like. And I think it's a similar sector now. I'll look for a nod from Hazel on this next reference, but I think you get these things called appies now, which integrate different systems. Is that the right phrase, Hazel? And they seem to be a lot more readily available than they were, and help in some instances to smooth out those problems of systems talking to each other, because people who invest in these systems, and sometimes those investments are quite dated, but it's a big decision for a business to change it. So they want to try and use that, but then there's something else down the track that will help add a bit more value over there. And it's how they get those to talk. And in the past, that would have been a really difficult, and very costly. Now that is a lot easier to do, and people are using that, especially in the return to the workplace at the moment. That's where I'm really seeing that. It's okay. How much are these desks genuinely being used? How much of a footprint do we or don't we need, or what can we do to use that footprint differently? Which is quite nice to hear with some clients. They're not saying, "Oh, we're just going to cut a swathe through our overhead." They're actually saying, "We'll look after the health and well-being of our staff and have a bit more space around that and use it in a different way." And this suite of desks can only be booked. I was talking to somebody the other day whose client has integrated their IoT sensors with their access control system, and they have a capacity for the building now in the post-COVID world, if I can use that phrase. And when they get to that 100% of that capacity, and in increments of 5% before that, if you get to 95 and 100%, it will start to limit who can come into the building. And at 100%, people can't access through the access control system. So they can't go in because the building's deemed to be unsafe. But there's a danger of health to people with a pandemic in the world, which is quite a smart way of doing things. And people are aware of it, they're inducted on it.
Well, that's one thing I was going to put to you, Edward. Within healthcare setting, people are a lot better at using tech than they were 15 months ago, QR systems and things like that. Are you seeing that the use of sensors and things just escalating all the more within that sector?
It is. I mean, all our clinical systems are now on handheld devices. So the whole, your medical records are now all digital. And all the nurses you don't have a clipboard at the end of the bed. All the nursing staff have iPods.
Oh, right.
And they can, do drug prescription monitoring, and they do all sorts on it. It's really, really quite incredible. And there's a big digital journey around the whole trust, and we're sort of piggybacking onto the back of that. So we're going to digitize everything else, and we're working on a smart office set up as well, like a booking. It'll be a large open office with welfare facilities. But it'll be a bookable one, so hopefully we'll be using the FM system to book the space in there, so it'll have a maximum occupancy. And if we will put some smart lighting, things like that, because of the new builds that were coming on stream, we want to do a sort of a mock-up of what would be the ideal new style of office that you book into. So we are looking at more technologies, and even on the new build, looking at possible robots for manoeuvring the food around the catering, so they could actually go from the kitchen to the ward, and they'll take the linen and the waste trolleys backwards and forwards. So, I mean, in an ideal world, it's difficult integrating that with the old buildings where it wouldn't fit. So, but we are looking at lots of new technology to try and integrate.
Brilliant, thanks. We're just about to finish off. Hazel, just the last word from you. Sure. How do you see the sort of sensors AI stuff integrating them with the rest of the sort of CAFM and integrated workplace management systems?
Yeah, I think as Mark said, robotics and AI, there's quite a lot of talk about it. In reality, there's not been that much adoption. We do have one particular healthcare customer that does integrate our system with a whole host of systems at their hospital, one of which is automated guided vehicles that sort of drive around the hospital, delivering linens and things. So it is happening. It is definitely in its infancy, but I think it will continue to grow. In terms of the sensors, I think we're seeing more of that. particularly short term now with COVID and making sure that, you know, a room doesn't exceed its max occupancy, see where people are sitting. We're seeing it in our daily lives now. You know, you can tell if the gym's full before you even get there because you're told on the app. You see how busy the train carriage is because of the sensors in the carriage. So I think that's starting to have its effect now. And I think hopefully once we're through the phase of COVID, then it will be used, as Edward says, to look at how you best utilize space, not to get rid of space, but just use it as effectively as possible.
Thanks so much, all of you. Really interesting discussion. If you want to re-watch this event, it will be available on the site until the end of July. Thanks for all your questions, and thanks very much to the panel, to Edward, Mark and Hazel for sharing the sort of the latest data decision things that can happen in the workplace in the future. Thanks. Bye-bye.